Our patients are not ill. They're trying to survive in a society and a culture which mistreats that which is different.
The issue with working with our LGBTQ youth is that we find through research that they're at significantly higher risks of things like homelessness, substance use, depression, completed suicide. This is a population that's really at risk and really vulnerable to a lot of the issues that we're trying to combat.
Young people who come from non-accepting families are over 8 times more likely to consider suicide than those coming from families that are accepting. It makes a huge, huge difference. I was looking at statistics for homelessness. At least 1.7 million young people are on the streets on any given night in the US. 40% of those are LGBTQ kids, which is a huge statistic.
The stress that goes along with being homeless, the lack of support, being out of school, having very poor peer relations, being food insecure, substance abuse, all of those things really tend to complicate the person's journey towards wellness and being a healthy, productive member of society.
Suicide is the second leading cause of death amongst our young people. Teenagers identifying differently on a sexual orientation or gender expression scale are between 3 and 4 times more likely to attempt suicide.
Not all of them are out, and so a lot of these struggles are really internal, and there's a whole process of coming out that these kids are going through and struggling with.
As an LGBT youth, it feels alone, very much so, because many other youth who are LGBT don't speak up and say, hey, this is who I am as well, if the culture of the school or home doesn't feel safe.
We really need educators to be alert and looking out for things in the school around bullying and targeting of this population.
Especially for younger men, younger boys, there's a level of shame. The more it's unspoken, unnoticed, it grows and grows and grows.
Schools can make sure that they have student organized and led organizations.
Schools that do have gay, straight, trans alliances have reduced rates of bullying, reduced rates of students dropping out of school because of bullying, and they've reduced rates of bullying overall for everyone. It creates more of an open, affirming environment for the school culture.
People who are having transgender thoughts or some transgender feelings can experience depression and anxiety at a much higher rate than the general population. So I think it's important to look for the secondary symptoms, recognizing that something's going on and you don't know what it is. And so then it's really important to ask.
They may not respond to you on the first time. It may take several times asking the youth, what's going on? I'm noticing these things. Are you okay? What's happening? And being very specific about what you notice.
It took a long time before they had the nerve to tell you. So be open, be supportive, ask questions. As you are proactive in every other area of your child's life, whether it's sports or music or school, being proactive in this.
I think everybody knows someone that has somebody who's LGBTQ in their family constellation. Maybe start a conversation and tell me about, what you guys did and how is it working for your family and what kind of resources did you guys utilize?
A mental health facility is a great place to get started, and I think that individual therapy is a great place to explore those things, as well as some group therapy where there are kids potentially going through the same kinds of issues that you're going through.
That one of the largest protective factors that has come up again and again and again and again in research is having open, strong, supportive LGBTQ role models for our young people.
As long as a kiddo has at least one resilient adult in their life that they can turn to, trust, be open with, and that adult is empathetic and understanding, they have the best shot in the world.
We're all not chiseled out of the same block of granite. If we can all work together to accept, understand, and support people who have differences, I think a lot of those other issues will become less and less prominent in our society.
We can all make a difference. The great Mahatma Gandhi quote, "Be the change that you want to see." And we need to take that seriously as parents, as schools, and as communities.